Hi, everyone. Welcome to the Med Mentors Gap Years and Non-Traditional Students panel. My name is Sophie. I'll be the moderator today, so hopefully I won't be talking too much. I wanted to introduce you to our wonderful host of panelists today and let them introduce themselves for you. And you guys can just introduce yourselves with your name, your year, how many gap years you took, and any other additional information that you think would be helpful. Green, do you want to start?
Sure, I will start. Thank you, Sophie. My name is Green. I'm a first-year medical student. I am from LA. I took 6 gap years. Went to UC Berkeley for undergrad. So yeah, excited to be here. I will popcorn it off to Maria.
Hello, my name is Maria, also a first-year medical student. I also took 6 gap years. I graduated from Brown back in 2016, and I'm from Escondido, California. And I'll popcorn it off to Rocio.
Hi, everyone. My name is Rocio. I am from Los Angeles, California, and I took 4 gap years. And I went to Cal State Northridge and majored in psychology. Nice to meet everyone.
Hi, my name is Emmanuel, and I took 3 gap years, and I'm an MS4, and I'm originally from the Bay Area in Santa Clara, California.
Hi everyone, my name is Ben. I'm a 4th year as well. Took 2 gap years. I'm from San Diego. Also went to Berkeley.
Awesome. Nice to meet everyone. So the first questions that we have are going to be kind of around deciding why to take gap years or and what you kind of did to prepare yourself to apply, I guess. So the first question is, what goes into the decision to take or not take a gap year? What were your pros and cons?
I guess I can start. I think for me, the biggest thing was how ready I felt to apply to medical school. I definitely I had to retake the MCAT. I did a post-bac. I did a post-bac at UCLA, had to retake the MCAT. And then during this time was a teacher, and had like a full career as a teacher. And so I loved my job and then also was doing a post-bac, and then also was applying to take the MCAT again and studying for that. And so I think truly it was like how ready I felt to apply to medical school. And I think right out of undergrad, like the instinct is to just apply because that's what like everyone else who's pre-med is doing it. And, like that just kind of feels like what the next step might be. But if you kind of have like an honest conversation with yourself about how successful your application is and how many maybe like how strong your application is, and then if you don't really feel like it is where it needs to be, it's okay. And I think it worked out in my favor because all through my interviews I was asked about my time as a teacher, and now that I'm applying for residency I'm talking about being a teacher like 50% of the time. So I think whatever it is that you do, if it's something that you love and you spend a lot of time doing it and you really enjoyed it, I think it actually ends up benefiting you. And I don't necessarily see it looking back as like an issue. I almost feel like it was it's kind of a strength now, because I get asked about it all the time. So that's my 2 cents.
I have to agree too that I wanted to take the MCAT a second time, but also I just didn't feel like my application was ready. I feel like I could have done more in terms of volunteering, in terms of research, in terms of leadership positions, and so I'm happy that I took the time off. It kind of let me explore things outside of medicine. I worked with children with autism spectrum disorders for a year, and that was a really amazing experience for me. And it kind of got to let me try everything else to see if medicine was really what I wanted to do. And I feel like after doing 3 years, I was a lot more confident and came in as a little bit more of a mature applicant that said, I've tried other things, I've tried research, I've tried working, but medicine is what really matters to me, is how I want to do. So I think that it actually helped me a lot.
I echo the sentiment as well. For myself, I when I graduated, like even while I was at Brown, I already knew like I was going to need to take some gap years off because being at Brown, I wasn't very comfortable to go outside the bubble. So I also didn't have much like clinical experience there. So it's like, okay, I'll need to take some time, figure something out. And so I found a job as a CNA after just taking a community college course to get my certificate. Then I was working as a certified nursing assistant for, yeah, pretty much the 5 years because I got my certificate in late 2016. So got a job early 2017. And that was just a great experience for me because I learned so much, on the job. And yeah, I also had to go through the struggles of like graduating Brown. They don't calculate GPA. So when I figured it out myself, I'm like, ooh, yeah, that's kind of low for a science GPA. So I did my own do-it-yourself post-bac. Luckily, kind of unluckily, but during COVID, I was able to take advantage of the fact like, oh, online classes are a thing you can now do. So I was able to make those expenses work a little better by taking a combination of higher level science classes, some that I could find even at community college level, and then others at like UC Berkeley Extension Center, which weren't so cheap. But after working for so long, I was able to have that money saved up to do those expenses. And yeah, just finding other opportunities as well during those 6 long years. I was able to work at a family medicine practice as an unofficial medical assistant, patient care coordinator. I was able to find research, started off as a volunteer, then got paid. So that was like a 4 year long thing. So it's just like a lot of things. And then of course the MCAT. First time I took it during college, it was out of spite. Bad idea. 2015 when the new one came out. But then I ended up having to retake it. So I took it for a total of 3 times. Don't do that. Just take it when you're ready.
For me, it wasn't really a decision that I made that I was going to take a gap year. It just happened because I didn't have like much resources. Because I was a transfer student to UC Berkeley. So I didn't know like what I need to do as a pre-med. I didn't even know I was a pre-med. I knew I wanted to go to medical school, but I just didn't have much resources. So if you guys are already here listening to this, I guess session, you're already way ahead of me. But I looking back, I like Maria, I also worked in healthcare for 6 years. So I worked in primary care, ophthalmology, behavioral health, mental health. So I would say I do appreciate those experiences now that I'm in medical school. It gives me confidence when I'm not working with patients yet because I'm a first year, but we have FOP, which Sophie is my group, where you are talking to standardized patients. So they are acting, but I think I feel a little bit more comfortable than my peers who maybe haven't had that experience before.
Awesome. Ben, do you want to answer or
Yeah. So for me, I honestly initially I was only planning on taking 1 year off. I think being at Berkeley, I was very tired, and I'm sure that's how a lot of people feel at UCLA as well, and actually just probably across the country. Being pre-med is not easy, and I think a lot of times we push ourselves really hard. So I think it's always a good idea to kind of just evaluate where you are, like mentally, and also like just like seeing how you're feeling. So initially I was only going to take 1 year, and then some life stuff happens, and you just have to adjust to that. So I ended up taking 2. And during that time, I kind of was doing more medical volunteering slash internships, and kind of just like figuring out why I wanted to pursue medicine in the first place. I think it was a lot of self-reflection, and I think also not being in school gives you a greater appreciation for life outside of the school setting. I think a lot of our classmates who didn't end up taking gap years kind of have that regret where they're like, I don't know what it's like to not be in school. And they never really got that break between undergrad and med school. And I think that's kind of one of the benefits that the gap year can give you.
Awesome. Those were all really good insights. Another question I have kind of building off of this is, what are some of the common myths and misconceptions that you heard about gap years, and are they true?
I think I've heard people say like, oh, like if you take a gap year or something, you might never come back to school, or it's really hard to re-enter school after that. I think that's true to some extent, and that you have to kind of get used again to disciplining yourself to study and balancing that with other stuff. But I honestly didn't find it that hard. I think that, when you start medical school, they give you a lot of good resources and kind of help ease you into studying again. And I honestly didn't find it that difficult to transition back from working to going to school. It took me about maybe like a month or two, and I kind of got my study habits and routines. And a lot of times the programs you go to have like MS1, MS2, or MS1, MS3 buddy systems. So you can have an upperclassman that can also show you like tips and tricks about how to study. So I actually don't think that it's that hard to come back after taking a gap year.
I think I definitely agree with that. I think also medical school is so different from any kind of studying that you've ever done in your life. And so I think that that misconception that like you don't know how to study, I think literally none of us really know. Like we're learning like as we're doing it. And it's studying for, I don't think I've studied in med school how I studied as an undergrad because they were just completely different things. And so I think everyone's learning, like every single person. No one's like a professional studier by the time they start medical school. Like that's not true. Um, and even now as a fourth year, like you just change it up. Like you always just change it up. I think one of the misconceptions I had for myself was that it was going to be viewed as a weakness. Like when I got interviewed, I definitely felt like I was behind or like my application like was weak because I had gap years. And it wasn't until like I literally started interviewing that I immediately was like, oh, wait, this is actually helping me. Because everyone who asks me about this is like excited for me to talk about it. And so I think that feeling of like I'm wasting time or I'm not doing what everyone else is doing or my application is weak because I'm taking this time off is like totally just like a made up thing that we have. It's definitely an asset, I think, if you obviously you have to present it well during an interview and like you definitely have to have something that you did during those 4 years and it can't be just like I studied for the MCAT. Like it literally has to be something real that you did for 4 years. But if you have that, great. They're going to ask you about it and it will work in your favor. But if it's literally like, oh, I studied for the MCAT for 4 years, then yeah, obviously. But it's like how you present it. And we all did great things during this time, but it's like how you talk about it too is also important.
Well, I guess one misconception that I had is that when I get into medical school, I thought I was gonna be the oldest person ever, and then everybody's just gonna be young and like right out of college. But actually, I really do appreciate UCLA having a lot of non-trad students. I think we definitely do need that diversity because we're gonna be working with patients who come where they come from like different walks of life. So don't ever feel like, oh, I'm too old to apply or too old. Like everybody's just gonna be younger than me. So don't even, yeah, think about that. I don't think that's not true at all, at least not at UCLA.
Yeah, I think we have some 45 and 36-year-olds in our class, so we're definitely not fresh out of college school for sure. Anyone else have one that they want to share? So Rocio kind of talked about this, but how, if at all, did your gap year activities factor into your interview experience? Were you asked about them often?
Yeah, I guess I can talk about this. So I think, like Rosie was saying, is that those gap years are not meant to just like waste. If that's what you're ending up doing, then that'll definitely hurt you on your application. You can't just be studying for the MCAT for 4 years or for 2 years or however long. But if you use those years effectively, whether that be exploring more about medicine, whether that be volunteering or doing something, like that is effective use of your time, and that is going to play out as something in your favor, and it's going to come off as like a strength, and they'll always ask you about that stuff. So like even when I was like just working, so like I did a lot of random stuff, like a lot of small things during my gap years. And one of the things that I ended up doing was like I worked as like a waiter at a sushi restaurant, and I never thought I'd be asked about that stuff. But like even for residency applications now, I'm being asked about that stuff to say like, what have you gained from that experience? And to me back then, like I was just doing it for like fun because I just wanted like some like side cash. But honestly, like it's not something that like I had thought of as, oh my gosh, like I'm doing this for my app. but it ends up kind of being that way because that's something that's like not everyone does that like comes into med school, right? And it doesn't have to be something that's like super, amazing or something like that. I know a lot of our classmates do amazing things during gap years, but not everything has to be that way, I guess is the thing. But ultimately, as long as you put in the effort and you learn something, you gain something out of it, and you can talk about it in a positive light, I think that's going to come off as a strength.
Yeah, I also think for interviews, like you usually get asked in some way, shape, or form, like, oh, what have you done since graduating, right? But also like sometimes what your experience is, what you do, because like the more well-rounded you are, like it'll really help out, like even with like more like in indirect ways, like when it comes to like MMIs, so the motivational interviews, where you're giving a random scenario potentially rather than just like the straight one-on-one traditional interview. Because like I remember there are a couple of times where it's just like I was like, given a scenario and it's like, oh, I had kind of a similar scenario working as a certified nursing assistant, so I can easily talk about that and tie it in, something specific that I've experienced firsthand. So it's like it's not always just directly like, what did you do during that time? What did you learn from it? It's sometimes indirectly too. It's like, oh, I never realized like something that I did is coming up now in another situation. I didn't think about it.
I think part of it too is that, you're trying to stand out amongst a crowd of many, many students with good scores who've done research, who've done volunteering. And so if you can use those gap years in a meaningful, interesting way, I think it can make you stand out that much more. And then when like the admissions committee are thinking about their applicants, like, oh, I remember that guy who worked at a sushi restaurant or that person who worked as a teacher, and it just stands out and they'll remember you. That can help a lot in the process.
All very good points. And kind of building off of that, how do you think that your gap years have impacted your medical school experience?
I think that like I can only speak on my experience, and I was a teacher for middle school students for 4 years. And I don't think I've quite honestly like encountered anything more chaotic than the 4 years that I did that. Like seriously, it's like the master of wearing all the hats at the same time. And I didn't realize that I was going to need to do that. And I think medicine is very much, especially as a med student, you're like running around doing a million things and like none of it really makes sense. And like you're just being asked to do random things all the time. Um, but then also I think as a professional, as a person, as an adult, I definitely became an adult when I became a teacher. Before that, I was just a student. I was an undergrad, but when I like was in charge, when I was the adult in the room and like I was responsible for like teaching things that kids had to remember, like I don't think nothing could really have prepared me for that until I was actually doing it. And then when I started medical school, like it didn't seem that crazy. It didn't seem that chaotic because I had already done something really hard, which was learning how to be a teacher. I think any teacher anywhere in America, the first year of teaching, first 2 years of teaching are incredibly difficult because it's just the learning curve is so steep. And so when I started medical school, well, a lot of people kind of for the first time are feeling that like really steep learning curve. But I had already done that. So it just felt like a new challenge. It didn't feel like I was like becoming an adult, like dealing with things like for the first time and like being truly having to kind of harness my maturity levels, which medical school is very much like that. You deal with like really sad stuff, really traumatic things, like people have hard lives and they're like telling you this information and you just have to somehow be able to like speak to people about these hard things. And if you've never done that, it's very intimidating. But if you have, whether it's like you were a CNA or you were a teacher, or you did whatever it is that you did in life, that life experience, I don't think really you could get it anywhere else than by living life. And it was just an incredible, I wouldn't change it. I wouldn't want like one gap year for exactly what happened for me is what was perfect. So definitely trust that like your journey is the way it's supposed to be.
That was very well said. So another question kind of now that we've talked about the impact of these gap years and your decision into going into a gap year, I kind of want to transition a little bit more into how you guys planned your gap year activities and how did you guys decide what was best for you? So the first question I have is, how did you go about finding and funding your gap year opportunities?
For me, so I went to UC San Diego, and they had a program called the BSMS program. So if you started research as an undergraduate, you could continue it as a master's student. And so I was kind of able to pay my way through by teaching. And so I think it helps a lot if during your undergraduate time you find some kind of organization or teaching position or research that you find impactful, and then you can use those gap years as a way to kind of expand on what you've already been doing. I think that gave me some structure and direction because it wasn't me completely starting anew in these gap years. It was me continuing stuff I had already started as an undergraduate. And it just showed that I was willing to put that much more time and effort into building more of those experiences. So I definitely think starting something or finding something, even if it's at a lower or less time commitment level as an undergraduate, and continuing that in your gap year can be very helpful.
So I kind of had like the opposite experience that Manny did. So initially, like I was up in the Bay Area at Berkeley for undergrad. I was planning on taking initially like one gap year. I had a job lined up as like a clinical research coordinator at UCSF. And then some life events happened and I had to like drop everything, come back home to like San Diego. And then like I ended up at least being able to stay with my dad, but then I didn't have a job lined up. I didn't have any experiences that were like going to help me at all. So in that moment, like I ended up picking up like a few part-time jobs just to kind of like sustain myself, while at the same time kind of like reevaluating like what I needed in my application the most. And at least for me personally, it was clinical experience. Was something that I felt like was just really lacking. Berkeley doesn't have a medical school like anywhere near it. The only thing is like UCSF, which is across the bay. It's really far. It's really not feasible. Whereas, you know, here, like the med school is right here, the hospital is here, so it's very much easily accessible. So for me, I was like, okay, like that's what I need to do more of. So I ended up spending a lot of my time doing the part-time jobs that I had to kind of fund myself, but then also spent most of my time doing the medical internships during my like 2 years that I was there. So the application process for that took me like 6 months, but then after I got in, I was doing that for the majority of my time for about a year and a half. So I think it just comes down to like what you think is what you need and prioritizing what you think your weaknesses are in your application and kind of doing that. And we all have our own strengths and weaknesses. And I think it's just a matter of being honest with yourself, and being like, yes, like this is what I need to do, and kind of just following through with that.
So for myself, I had remembered I had worked well, I volunteered in high school at a hospital and I was kind of like the assistant to a certified nursing assistant. So after I came back from Brown, I'm like, oh, I remember certified nursing assistant is something I can do. So I researched it and I found like, oh, if I go to a community college, you know, I just take a semester long course. And they were fortunate, like they brought the test to the school, so I didn't have to like drive anywhere even to take the test. That was kind of already taken care of. So it kind of made it a little easier to get that. And then it's like, yeah, working as a CNA, especially when I started in 2017, full wage transparency, I was being paid, I think, like $11.50 the hour. So I was not making that much money. But fortunately, you know, I was living with my parents, so I didn't have to worry about those kinds of expenses. It was more like, you know what? I got my little paycheck. I would work double shifts to make that little paycheck go a little further. And then it's just saving up that money. And then it's like being in that environment as a CNA. I just got fortunate enough. I met a doctor who came up to me and it's like, hey, are you pre-med? And I was like, yes. And it's like, oh, cool. You can shadow me if you want. I'm like, awesome. And then that turned into a like, oh, you can volunteer at my place if you want. I'm like, cool. And then that turned into like, oh, you want a job? We can give you a job here. And I'm like, great. So it kind of things kind of just fell into place. But from that initial decision, I never even thought of it because my first goal was going to be like, oh, I'll work as a CNA at a skilled nursing facility, then I'll go to a hospital, and then you know, uh, hopefully make more money that way to save up to uh, get into medical school and do all I needed for my classes. But yeah, it kind of just things worked out that way. But just finding the opportunities and taking them as they come to you as well.
Green has a pretty cool story too. She just doesn't want to share.
I mean, I guess, well, because I worked in so many different offices, just kind of adding on to what Maria said, I also work with like with a small office, primary care office. I think that was a really good experience. I had to work really hard because since, you know, there are not that many people there, you have to do tons of different things. Sometimes you're a medical assistant, sometimes you're a receptionist, sometimes you're like their health navigator. And um, I think just having my first clinical experience in a small office was really helpful for me. Like Ben said, I never got a position at working at a big institution, but just having that opportunity to work in a small office, you get to know your patients, you get to know your team that you're working with, the doctor you're working with. And I think that's like a good experience to have, because ultimately you're all here because you want to be a physician, and having that I guess kind of environment where you're working closely with the doctor, I think would be helpful and give you insight if it's something that you want to do for the rest of your life.
All very good points. I guess another question kind of building off of that is, Ben kind of mentioned it in terms of targeting weaker parts of his application by doing those clinical internships, as well as Green with her MA positions and a small clinic. But I get a question that got asked was, how can I take this time to improve my med school application? If anybody has any insights into like postbacks or specific programs that they did to kind of build their application specifically, it's your time to shine.
I guess it'd be helpful if we could know like what they are like lacking in, I guess, if it's grades or experiences, volunteering, research.
So
Did they specify?
So one person in the RSVP specified lower grades, and then another person mentioned building their clinical experience.
I think somebody here has said that they've done post-bac or something like that.
I did my post-bac at UCLA, but I feel like it was it was like kind of a hybrid. Like it was definitely structured, and we had meetings and like mentors and specific workshops that we did, but then we had to take classes through UCLA Extension, and that was like kind of like whatever you needed. My post-bac took 2 years because my science GPA was crap. And I think Green or Maria mentioned, like I literally didn't even know how crappy it was until literally I didn't realize that. And so I had to take a lot of science courses through UCLA Extension, which I was able to fund because I was a teacher. And I lived at home with my parents. And so literally my entire paycheck was to pay for post-bac classes. And so it was like kind of a hybrid between taking whatever courses I needed through UCLA Extension, and then with meetings with mentors and things like that, that was like supplementing it. So it wasn't like I was enrolled full time, or like kind of like a master's program is what a lot of people sometimes will do as like a post-bac thing, is they'll enroll in a master. I wasn't enrolled in a master's program. And I don't think it wasn't like a degree post-bac. It's kind of like a hybrid situation that UCLA has.
Great. So now a couple of questions on navigating non-traditional. If anybody has any particular questions, please feel free to add them to the Q&A. We are happy to answer them there too. But one question that got asked was, what are some of the resources that I can use to find out what classes I need to take?
As in what classes is a pre-medical student to take?
I think what they're kind of asking is just in general where to take those.
Yeah, I think I imagine there's a lot of consistency between different medical schools, but if you kind of like look at their application website, so if you go into like missions for, let's say, UCLA, they usually list like the required coursework. But generally there's your core like biology, chemistry, organic chemistry, things like that. But I think you could also probably check the AMCA's website for requirements for admission. But if you go to an individual medical school program onto their admissions committee page, it should list what kind of classes they want you to take.
Awesome. I think a couple of other ones that you can do is you can look at them at the MSAR, which is I forget what it stands for, but it's a resource from the AAMC that basically lists all of the requirements and the averages and all the statistics and mission statements and everything you can possibly want to know about a medical school, except for like extracurriculars, on this like collected document, and it can tell you what classes you need to take too. Another question that people want to know more about is, have you met any non-traditional students in your medical class? I think we mentioned that UCLA is a big school for non-traditional students, and is it common?
I don't know what the statistic is, but it definitely felt like at least half had at least one gap year. I don't know what the stats are though, but I mean, all of you guys, all of you overall classmates, and I think like I want to say at least half. I don't know about you guys. How do you guys feel?
I think the average age of admission now is like 24 or something like that. So the average college grad is like 21, 22. That usually equates to about 1 or 2 gap years. But yeah, I'd say the majority of the people that I encountered in my class actually took at least one gap year.
I think our class is about the same. A lot of people, majority, I would say at least one or two. And then there are people there. I think I only know 2 people who just went straight through. Out of, I don't know, I would like to say like I know 100. But yeah,
I only know 2 or 3 as well.
2 or 3, yeah, less than 5 for sure.
I know in the fourth year class currently, there's definitely like quite a lot of people who went straight through. I'm not saying not like you don't have to take a gap year, like by all means, like if you can go straight through, like, power to you. But I think statistically in the trajectory currently right now is that more people are taking gap years and it is normal to do so. And even if it wasn't, it's okay to take a gap year. So like don't feel bad about that, I guess is like the main thing.
I mean, I've had friends express to me too that they kind of wish they had taken a gap year just to see what life outside of medicine was. I mean, when you start this journey, you've got 4 years of undergrad medical education and then 3 to 8 years of residency. So you're looking at like a decade-long career, and that's just the training before you start working. So I always say that once you're in, you're in. So there's no rush to get there if you're not completely ready.
All very good points. Another question that got asked in the RSVP is how did you make sure that you didn't fall behind during your gap years? Any tips on what to do during them? How do schools look at applicants that took gap years? So I think we answered the second part, but I think the first part of that question is really important.
I don't think I'm the best person to answer this, because I took so many and it wasn't planned. I was kind of going with the flow. Um, I would, unlike other people who already mentioned, I don't think I would say like I would do 6 year. I would if I were to do it again, I don't think I would take 6 gap years. So I think definitely having that plan, like what you want to do, knowing what you want to do, and yeah, having that plan and being more prepared, I'll recommend. But that being said, like I don't want to say I regret taking so long. So if you're in a place where you don't know what you're doing, you feel like you don't have anybody to reach out, definitely, I mean, we're here, med mentors, right? And so definitely be proactive. I think it's really easy for you to kind of like get lost in the real world. Like for me working, like I was working so much because I had to, well, we already talked about fun, whatever, my life. So I think definitely having some kind of like, if you have group of friends who are pre-med, or like if you're part of an org or something like that, having the mentorship is also important, so that you have somebody reach out and ask a question like, am I, or I guess like you can't really like, to have that guidance. I think having that guidance is really important when you are taking your gap year. Yeah.
Something that I did, I only took one gap year, but what I kind of recommend is that if you can, take your MCAT while you're still in undergrad, because you're in the process and you're still studying, and it's just going to be one more test that you need to take. And you're going to be in that mindset, or take it soon after you graduate. So at least it's within the realm of when you've taken those classes and you've been exposed to that material. And then the other thing I would do is try and gather the letters of recommendation letters that you want, to at least have them stored and ready to go, so that you don't have to go back 5-6 years later and be like, hey, remember me? I was that little freshman in your class 8 years ago. Do you mind writing me a letter of rec? Here's like my personal statement, basically asking somebody to write a letter based off of what you're telling them versus their experience of you, which is not a bad thing, but it's just a little harder, and it's a little more awkward on your end too, to send that email. And then the other thing I would do is make a list of all the extracurricular activities you did in undergrad, and the things that you would want to highlight at this point in time. So at least you have something to go back to, and you can be like, oh, actually, I don't want to do this one anymore. And you just swap them out, which makes it a lot easier when you get back to the application to get that going again, because you're going to be working 40 hours a week minimum, probably, when you're applying, if you take gap years. And it's a lot harder to go back into the thinking mode that you're so used to being in an undergrad. But you will have so many more experiences to share after that 1, 2, 3, 4, however many years you decide to take.
Well, Sophie, that's exactly what I did. I asked my professor from 7 years ago to write me a letter of rec. And if you have to do that, you got to do what you got to do. But yeah, ideally, you wouldn't want to do that. I didn't know there's something called Interfolio where you can store your letter of recs, because I could have had so much like better letter of recs. I mean, thank God I made it here, but it was definitely awkward emailing people that I volunteered with like 3-4 years ago, like, oh, hey, remember me? Yeah, so definitely having that resources, having the mentorship, have like an org or somebody to reach out to ask questions, I think is definitely important.
And the other thing to look at is also look at whether your school continues to offer career advice or career center resources after you graduate. I know Berkeley did it for at least 1 year at post-graduation, and other schools might do more. Another question that got asked is, how do you guys have any advice on finding shadowing opportunities and medical related internships during gap years?
I think if you can get your foot in the door with volunteering, that's one way without directly working. If you're able to become an EMT or CNA, that's probably the best way. I think you get the most direct interaction with physicians. But for me, I volunteered at a program called oh god, I can't remember the name of it, but it was like a medical, like pre-medical internship program in San Diego. And then kind of through that, while I was on the different wards and units, so I got FaceTime with some of the physicians, and that was kind of like my door into getting shadowing. So some kind of volunteering or either working will be your ticket into trying to get a shadowing experience.
I mean, Manny probably was doing Pathmakers, which is what I ended up doing during my gap year, because he was there for his undergrad. But I think as an undergrad at UCLA, it's pretty easy, I would say, compared to a lot of other places to get access to physicians, because the hospital's so close, so you can just walk to the hospital. I think great researchers are definitely like us to start off with, who have FaceTime with the attendings. That definitely has like third and fourth years. Like we work with attendings for first years and second years. Like it's more research, and like you still have FaceTime with attending. So if you have a specific interest, like you can definitely reach out to us to try to get you involved. But I think other ways would be finding other organizations on campus that may be linked with physicians. I know at Berkeley, even though we didn't have a hospital, there was like Oakland Hospital, Children's Hospital, and stuff like that, and there were smaller organizations that you could apply to kind of shadow this doctor. I personally don't think shadowing is super helpful in the sense that you have to have like 1,000 hours or like even 100 hours. I think most of us have way less than 100 hours. I think a lot more of the importance is coming from that patient interaction or even like getting an understanding what medicine is. And a lot of that doesn't have to actually involve any face-to-face time with, I guess, MDs or DO specifically. Like that time can be spent working with patients as a CNA, working as as an EMT with patients or with the nursing staff. And I think honestly that is probably more valuable than just shadowing a doctor around because you're really not going to learn that much from that. Besides being like, this is what a doctor kind of does, maybe on like a day-to-day basis. So yeah, I mean, I think shadowing is important to have, but it's not going to like it's not going to make your application is what it is.
I think to piggyback off that, I actually didn't have any shadowing experience, like nothing that I listed on my application as shadowing. But I don't know how local folks are who are on the call, but I did the clinical care extender program. And that one is set like at different hospitals. Mine was in Glendale at Glendale Adventist. But I know that I think they had one at UCLA, and there's like a few. It's like one program that has multiple sites. And it was great because there was a lot of structure, and I was able to, they rotated us through like different hospital units. And so spent some time in the ED, and I spent some time on the medical unit, in the labor and delivery unit. And what like it was only 4 hours a week. And because I started early, by the time I applied to medical school, I had like 400 hours. That's just because I was going like 4 hours a week every week. And it was just like something I was doing, and it was like super easy. And then I didn't have any shadowing. It was all clinical. It was like clinical experience, but it wasn't shadowing. And so you don't, if you invest your time like as an EMT or as a CNA, you don't necessarily also have to have shadowing like that. I think that definitely counts as like clinical experience.
Lovely. Another question that got asked is kind of some advice on how not to be hard on yourself for taking long periods of time for gap years. Somebody posted that they graduated in 2019 and they're kind of starting to feel self-conscious about it being so long since they graduated undergrad. Any tips on kind of keeping motivation and kind of keeping and not being hard on yourself?
That's a hard one. I think a lot of the time, well, let me just talk personally for myself. I think as a pre-med, you try really hard, and sometimes you don't get the results that you want, and it's pretty devastating when when you know medicine is super competitive. And I think it's been a journey, and I still even now where it's like just trying to like be nice to yourself and giving yourself some grace, I guess. I think it's a lot easier for us to like forgive other people, and a lot of the times you beat yourself up more than anyone else does. And I think it's kind of just a learning process to be okay with not being perfect. And I think that's a really hard lesson to learn. And I think it's always like a work in motion, I guess. And I think a lot of it just comes down to like being cognizant of that and being like just being honest with yourself, being like, I'm human and I make mistakes, and just moving forward, because even if you made a mistake, the mistake has already been made and there's nothing you can do about it. So beating yourself up doesn't change anything. And I think it's about moving forward and be like, what can I learn from this mistake and how can I do better so that I don't repeat the same thing? And I think as long as you have that mindset, like you'll go very far. I know that's like a really, like pretty standard answer, but it's hard to like be nice to yourself. I think it's like what it is at the end of the day. And I think the more you practice that, the easier it becomes. And like I said, like I'm still working on it, like even with residency, like applications and stuff like that. You're not going to get all the interviews that you want, and you got to be okay with that. And, life will move on and we'll all be okay at the end of the day. So just being okay with that and kind of just being humble and also just like living in the moment. I think the other thing is just enjoying what you're doing. I think during my gap year, a lot of times I was beating myself up because I was like, I'm not moving anywhere. I'm stationary. I feel like I'm stuck. But then for me, 2 years down the line, I got into UCLA, which I had never dreamed of. Like if you had told me, 2 years ago, I would have gotten into UCLA during like before I started my gap years, I'd be like, no, there's absolutely no way. But it's just a matter of like keeping consistent and just doing the work that you set yourself out to do when you start did those gap years, I think will give you the results, more results than you would have imagined, I think is what it is.
Yeah, I completely agree. It's just keeping your eye on the prize. If you know medicine is your passion, it's what you want to do. It doesn't matter how long it takes or how the road, shifts and turns. It's like you'll get there. You just have to keep working at it and, doing what's best for you at the moment, even if that is taking more time. Like for myself, having to take the MCAT 3 times, I actually got in as a reapplicant because I applied once in 2019 and I didn't get it to med school. But, I'm just like, that's okay. I'll learn what I learned from doing that application process and I'll go through it again in 2 years. And, in hindsight, it worked out because who would have thought then COVID hit? So it's like, it worked out better for me not to have started med school during COVID. So sometimes it's just like being able to, whatever it is that helps you keep grounded in yourself and having that support network too. For me, it was my family, living with my parents and my sister. It was great because I was just always supported, by their love and their confidence in me when I didn't always have it for myself. So it's just like not being alone during this journey, trying to find that network of support, whether it's with your family, your pre-med friends, or mentorship, whatever it is. And then just keeping your eyes always on like, this is what I want to do. So I will get there. It doesn't matter how long it takes or what I have to do, but slowly, surely, steadily, you'll get there.
Yeah, I totally agree with both Ben and Maria. I think also understanding that like, not everything's in your control. Sometimes not you, it's your environment and what you have to go through or what you're facing. So yeah, don't worry about how long it takes as long as you're keep working towards it. And then that if this is something that you really want to do, then you will get to do it. It doesn't matter how long it takes.
Those were all really valuable answers, and I hope that everybody listened to them because I could have really needed use them during my time between undergrad and med school. For the last 12 minutes, I thought it would be really nice to give our panelists the opportunity to share a piece of advice that they think that they would have really liked during their gap years or when they were deciding to take a gap year or anything related to non-traditional. Because I know that we're not able to cover everything during this panel, and I think everybody has their couple of gems that they have that are really helpful for other people. So whoever wants to go first.
I guess for me, it was like definitely the feeling of like feeling behind. And I think my biggest piece of advice is it's going to be okay. Like, none of this is really that outrageous. Taking gap years is not a big deal. Lots of people do it. It's a very normal thing in med school. Uh, it can be an incredible asset. Just trust that, trust your journey. Whatever you're doing during your gap years, have it be something meaningful, have it be something that you love, have it be something. And if you don't have that yet, find something, like really find something. And if it's just like I'm studying for the MCAT, like this is you need to do something, right? Um, find something meaningful, find something, and then learn how to talk about it. Learn how to talk about it during your interview because at the end of the day, they're just like gauging like your maturity, your professionalism, your ethics. And if you can talk about that in the sense of what you've experienced during the last however many gap years, it's an incredible asset. So trust that none of this is a waste of time. It's very normal and it can help you tremendously. So do not view this time as a waste, view it as an investment. And you will be rewarded for this time if you invest it well and you see it kind of positively, you will be rewarded. So you're okay.
Yeah, I think I'd say roughly the same thing. Like I was saying, it's just be kind to yourself. Everything will work out in the end. And I think if you asked any of us when we were taking our gap years, like we would not have thought we would get into UCLA. I think UCLA and honestly most of the med schools are just dream schools for everyone when you're a pre-med, you're applying, and you'll be surprised where you end up a lot of the time. And I think wherever you end up is like where you're meant to be. And a lot of the time people are happy where they go. So I think that just, continue grinding and, continue doing what you need to do, but try to enjoy the moment, try to like, just enjoy life as much as you can because things will work out. Um, I think beyond that, I think a tip that worked out for me a lot was that the personal statement is a very different type of essay compared to a lot of other essays that you write during your time in like high school or undergrad where you're writing about like an actual paper about like literature and stuff. Like the personal statement is very different where you're like talking about yourself a lot of the time. And I think what actually helped me a lot was just like journaling for about a year or so during my gap year, which I'd never done before. And it was a lot of just like writing in I statements and like think this or I did that or whatever. And because your entire personal statement is going to be in that, I guess, I don't know what the word is, but like you're going to be writing a lot of I statements. You're not actually like critically analyzing a piece of literature. And I think by doing that, it'll force yourself to kind of start thinking that way. And then it'll also like give you time to like self-reflect, which I think is super important when you're like going into this process of like why you're choosing medicine.
Yeah, I highly want to second the journaling aspect because, again, depending on how long your journey takes, sometimes you don't like anything that's interesting that happens to you, whether you're volunteering or working at whatever position that you're doing, make a record of it in some way, shape, or form so that you remember it down the line. You don't know how many gap years you might take, whether it be 2 or 6. So that way you can actually know and be able to use it when it comes up, like whether for an interview or for your personal statement or for your writing the most meaningful statement for one of those 3 extracurriculars. You want to know what you did and not just be like, oh, I remember something, but now I don't actually remember what happened 5 years ago. It was cool, but so I definitely recommend that, whether it's written it, typing it, or even like recording yourself, keeping like some sort of record of it in some way, shape, or form, keeping yourself organized. That'll definitely help you when the time comes for the application.
Well, I guess I'm repeating myself, but get Interfolio, get your letter of rights ready, and yeah, have them saved in your Interfolio. Also, what was I gonna say? Sorry, I lost my train of thought. I'll come back to it.
And I think one other thing in general too that helped me a lot too is I feel like sometimes we do things and we're not sure exactly how they connect. Like how does the research connect to the volunteering, connect to this clinical experience? But I think what helped me a lot was trying to define my own personal values, like what I thought was important to be not just good in medicine, but as a good human being. I think that I took the experiences I had, and even though they might not have been all connected, I talked about my values and about how my experiences in research and volunteering and medical practice all kind of like highlighted my values. And I think that made me have a lot stronger of a personal statement. So, and to kind of add to the whole self-reflection, like I was never the best at journaling, but I was able to kind of look back and see based on these experiences, like what do I value, whether that's friendship, that's family, that's hard work, these kind of cliche things. But if you can really talk about what you value and you have evidence from what you've done, I think that makes a particularly strong personal statement.
Just a quick note on what you said, Emmanuel, about like don't be afraid of like of writing something because it's like it's cliche, it's been talked about 100 times. But the thing is, it's like sure maybe the overall concept you can think of as cliche, but it's not. It's still going to be unique because it's only you experience what you experience and how you express that. Unless you're talking in very general statements of like I love science, then that would be cliche. But of course, what made you love science? That's going to be unique to you. And so that's what's important, making sure you convey that and not be afraid of like, oh, I can't talk about science because everyone talks about it. It's like, well, how does that relate to you specifically?
I remember what I was going to say. Yeah, get into folio. And then going back to the class, because I know somebody asked about the classes that you should take. You can actually check that with each school, like what they require, because that's what I didn't do before applying, and I wasn't able to apply a couple of schools because of it, because I'm not meeting the requirements. So if you know you want to go to like certain school like really bad, then make sure to know what are the requirements, and then you can also like email the admissions team to ask any questions that you might have, how they view non-trust students and stuff like that. And yeah, and I think just generally get mentorship, get connected to pre-med community so that you're still working towards your goal instead of just like working and doing other things.
Those were all really valuable pieces of advice for sure. And if you have any other questions and you want to talk to non-traditional students at UCLA, I think that a few of you guys have profiles with med mentors where you can set up one-on-ones. You can also feel free to email med mentors, or if you guys want to put your emails in the chat, feel free to do that too, so that students or interested individuals can contact you regarding gap years and anything like that. And I'm going to do one quick last call for questions. If anybody has questions that they have not gotten answered, if not, you are free to go. Thank you so much for coming. Thank you so much for our panelists. It was really great hearing all of your guys' insights and about your guys' journeys. So thank you.
Thank you, Sophie.
Yeah. Have a good night. Oh shoot, you guys, I'll copy and paste all the emails to the actual everybody. So that's that one. Screens. That was my fault. I apologize. Sorry, you guys get a wonderful recording of me just copy and pasting.
All good, Sophie.
Alrighty.
Thanks for hosting.
Yeah, thanks for joining. I will stop the recording. Can I?